Hi, I have something for you. If you're dealing with Piriformis syndrome, maybe even sciatica. So Piriformis syndrome affects the sciatic nerve. It's the muscle that gets so tight that it presses down on the sciatic nerve. And sometimes people who think they have sciatica actually have Piriformis syndrome. And that's good news because it's super easy to care for. And so let's do this together and see if this helps. So first thing that I want to do is lie down on the ground. We're going to do a little stretch to prepare ourselves for a bigger stretch. Okay, so first lying down and get on your back. We're going to do a little thread the needle. So thread the needle, you'll take your ankle over the other thigh. Now you want your ankle bone to not be digging into your thigh, so just move it over. You're going to take the right hand through the window and either grab underneath the thigh or grab around underneath the knee, around the shin, and pull in. Take your right knee out to the right and breathe with me. So close those lips, long, smooth breath. And feel that breath in the back of the throat. And you can stretch here longer. So you would do the other side and then move on to this next piece. So this part for me, like this one is the money if you've got anything going on with your piriformis. This is something I call Fosse because I have a dance background and there's this choreographer and his name is Bob Fosse. And they always do these things where they like sit into the hip. So we're gonna sit into our hip. So it may look a little jazzy at some point, okay? So bear with me. So what we do here is we take the right foot and you're gonna turn it out to about a 45-degree angle. And then you tuck, or you just take this back foot, put it behind you. If you have a dance background, coupe, all right? So imagine you've got this audience, you're gonna bow to your adoring audience, come all the way down. Now I want you to sit into the back of your hip. So I'm gonna turn to the side so you can see this. So I'm sitting right into the back of my hip. So I'm pretending it's like a little basket. I'm gonna just lay my weight down in the basket. And I'm breathing. So I'm getting a stretch here. And then I'm gonna turn around, I'm gonna twist around to the right. Okay, so I'm reaching into the back of my hip, I'm twisting around. And I'm trying to sit, like if I can sit on a bench behind me. Ooh, I'm really reaching into that hip. Now sometimes you're not sure if you got the stretch or not. If you're not sure if that worked for you, this is a little sometimes challenging to really get into the correct area of the hip. So try it on the other side. So again, 45-degree angle, the back foot comes behind. We're gonna come way down, squat way, way down, and then reach your bum way, way back. Really sit into the back corner of that left glutes, the left hip. All right, and then just really relax everything back into that area and twist. So sometimes we'll find it on the second side. We'll really find that deep stretch on the second side. And then when we go back to the first side, then you're kind of like more trained or aware of exactly what your body needs to do to get that stretch. So that's what I call Fosse, and it will give you some really good stretch in those glutes, especially the piriformis, which is really deep in those hips. All right, I hope that helps. Afterwards, it's a great idea to come into a forward fold with your ribs touching your thighs, bending your knees, however much to allow that to touch. Taking some long, smooth breaths. And there we are. Thanks for tuning in. If you have questions, leave them in the comments. I'll get back to you and I'll see you next time.